I want to start off. Do you have any questions about any one concept?
Not in particular, I don't. I'm just here really to gather more information and try to put everything in context.
Okay, great. So, exam three for most of the classes, if you're in more than one class, make sure we're recording, is in week 10. So, be thinking about if you have more than one class, the days of the week and the time that those exams will be administered. So, again, if you need your exam proctored, remember you have to give that 72-hour prior notice to your campus dean. Please include your course lead as well as your course professor in the email. But they do need that 72-hour notice in order to secure a place and a person to proctor that exam. The exams are timed, so be thinking about all those test taking strategies that we talked about through the term, identifying that key concept, and answering what the question is asking you about that concept. There are some times where there's more than one concept in the scenario or the question, but be sure to answer the question about the concept that it is specifically asking you about. There's a 75-minute time frame. Please, just remember that. Make sure that you're reading through, taking the time to go back and make sure that you're answering and selecting the answer choice that you really want to select. Of course, there are 50 questions. There are multiple choice. There are select all that apply, and they are math questions. The exam will cover week 7, 8, and 9. Go back through your classroom recordings and be sure to review the exam review recordings as well. Send an email or some type of notification or reach out to your professor in the event that there's a concept that you are still unclear about prior to the day of the exam. Remember, you will need your ID for the exam. The downloads of the exams can be done at least an hour prior to the exam time. So make sure that you get that done so that there's not any unneeded, undue stress in the event that there's a glitch or something with exam solve. All right. So remember, week 7, we covered infectious diseases and prevention and control. What is that single thing that one thing that we all can do, whether or not if you're healthcare or a layperson,
Wa-
that can decrease or prevent the spread of infection?
Wash your hands.
Washing those hands. Hand washing has been, it has been proven. Keeping those hands washed before and after, before and after, before and after. We do know that we have that hand sanitizer, but make sure that the appropriate amount of alcohol is an ingredient in that hand sanitizer. But in the event that there is soap and water, running water, we do want to wash our hands, even though the hand sanitizer is available. Proper hand hygiene is the single most important aspect of medical asepsis and infection control. So, let's talk about if we have a patient that they suspect or they pretty much know that they have tuberculosis. What is what's expected? Would that patient be in a private room? Would that patient be in a semi-private room, meaning that they're sharing a room with someone? Can they just go out and about throughout the hospital? Are there any restrictions? What do we need to prepare for?
So that patient should be in a private room and they should not be allowed to just roam around the hospital until I think, um, is it 48 hours of the antibiotics have been given?
Not sure about the time frame, but as long as they're in that hospital and that restriction is up, that they're on those airborne precautions, we should be, or anyone that's entering that room needs to be wearing that N95, or they call it a particulate filter mask. But by now, since COVID, everyone knows what an N95 is,
Mhm.
but it is called an N95 particulate mask. If that patient has to leave that room, because there are some exams that cannot be completed at the bedside, that patient must wear a mask as well. That patient should be in a negative pressure room, and I don't think I recall a time frame, but as long as they have that precaution sign up, any precautions, we want to follow those precautions that are listed, until that sign comes down. Okay.
And the patient will have an N95 mask as well.
If they have to leave the room for anything.
Okay.
Mhm. We do know that we're not for vaccinations and we're not against vaccinations. We just provide enough information so the patient can make an informed decision. There is data, there's evidence that has proven that vaccines have greatly decreased or reduced the incidence of certain chronic diseases in the world. Like I said, we're not, anti-vaxxers and we're not for that either way, but we're just putting that information out there. There is evidence that shows that vaccinations has greatly reduced so many disease processes across the world. So going back to the mask, even if that patient's on some type of precautions, whether or not it is, influenza, pneumonia, COVID, tuberculosis, the even the visitors have to adhere to those precautions as well. So there should be PPE, protective equipment available for whomever that's entering that room or that's encountering that patient. So it's for us, the patient, and their family members.
Okay.
And what was the name of that mask? I know we said N95, but what's the name of that mask that we wear? What's another phrase or word
Mm-hmm.
for N95? A special particulate filter mask. It's a mouthful, but that mask is really, really, really thick. So it's specially made because it filters out. I want to say that 95 is the amount of particulates that are in the air. And so a lot of times we have our patients in the hospital setting, they go home, they return home, but they may have a wound, and we want to still provide for them to have use contact precautions while they're at home. If they have a wound and they have dressing changes, what's some information or instructions that we should reinforce with that, with those soil dressings? What are some things that we should be reminding them how to dispose of those soil dressings?
I would say it needs to be separated like in a separate bag, a Ziploc bag or something like that, and then thrown away, not
Exactly.
thrown in the trash.
Directly, exactly. So any soil dressing, you want to place that in a different bag, any type of plastic bag. Make sure it is tied up securely, and then place that into the trash. Because they're not going to have all those bins that we have in the healthcare facilities, but that will decrease the chance of someone coming in contact if they place those soil dressings in a bag, tied up securely, and then place that
In the
into
trash.
in the trash can. Yes. Okay.
So I got a question. So the N95, I thought you had to be fitted for the N95,
You
right?
do. You do. You do.
So
So
would we,
for healthcare employees, yes, we do. But you have your business. They're not gonna get fitted, but they're
oh,
less than to contract whatever it is we're trying to protect them from.
gotcha. Okay.
Yes. Healthcare providers, yeah, we're fitted. But we just remember back when COVID was out, everyone was wearing N95s, and no, they were not fitted. And the reason that you want to be fitted is because you do want to wear the appropriate size.
Yep.
But if a person is on those airborne precautions, they will still, those equipment will be made available to them for them so they can use them as well. But as advanced as we are, you'd be surprised who's fitted and who's not fitted now because
Right.
it's just so common now. Like what was an N95? Now everyone knows what it is. So those things, like getting fit is becoming more routine. Just in case, just in case people run into those situations. All right, so let's talk about let's see here. So we know that hepatitis is a viral illness, excuse me, that attacks the liver. We have A, B, and C. B and C are bloodborne. And so we do have a vaccine that is for one of the hepatitis. Which one is it? It's a series that we take as healthcare
Help
professionals.
B.
Hep B, exactly. So, and just think about anything that when we talk about, well, who's more at risk for, acquiring the A, B, or C, but just think about those high risk behaviors. If someone is high risk for not washing their hands for whatever reason, because that is spread from fecal to oral contact. So anything that puts someone at high risk for not, even if it's a low literacy or they don't understand, and also if they are um, substance abuse users, anything that's making someone not think rationally will put them at higher risk for coming in contact with viruses. Hepatitis B and hepatitis C is bloodborne. And so, if someone is an IV drug user, have multiple sexual partners, anything that puts them that's considered high risk will have them have an increased risk for acquiring those diseases. Smallpox and chickenpox. So, where are these smallpox? If we're trying to determine if this is a smallpox vesicle or a chickenpox vesicle, where can we look to see if those vesicles are at or not at on a person that will indicate that it is smallpox rather than chickenpox? Where is smallpox found at?
Stomach or the back?
So the soles of the feet and the
Oh,
palms of the hand. Chickenpox are not on those places because their vesicles are really, they're kind of similar, but chickenpox is not going to be in the palms of your hands and on the soles of your feet.
so
So
that's
in the
smallpox.
smallpox, yes. So, of course, there are reportable diseases out there. Each state has their list. And so, if that's one of those reportable diseases, if you're that school nurse, if you're that nurse that's working at that industry, you're that occupational nurse, and you have several people coming in, or we have one patient that comes in, that will need to be reported to the authorities. And the authorities is like the health departments.
Department.
They oversee, those reportable diseases. And there are some diseases that initially people have signs and symptoms. And then patients they may or may not take medicines, but in the event that the doctor is trying to determine if that disease process has progressed to the next stage or the secondary stage, what is a screening test that we can do to detect whether or not a disease has progressed to the secondary stage. A screening test.
And are we talking about the hepatitis disease or any disease?
Any disease, what's a secondary intervention that what do? We screen. We're just trying to detect and determine if a person has I'm gonna give you a hint, high cholesterol. How do we know they have high cholesterol? How do we know that they have progressed onto the secondary stage of syphilis or another disease process?
Blood work.
Blood work, yes. So, with infectious disease, usually if they want to see if that disease process has progressed to that next stage, which is secondary stage, they usually do a blood test.
Mm-hmm.
And another word for blood test is serology. If that blood test come back as positive or indicates that that person has progressed onto that secondary stage, then we say that they have a positive serology or a positive blood test. Serum, we're drawing serum, we're screening to determine or to detect if that patient has moved on or has that disease process. Okay. So you all probably have heard that a person said, well, hey, I got the flu shot and I still ended up with the flu. The HPV vaccination and the influenza vaccination only has those prominent strands. The scientists, they study and they determine, well, hey, these are going to be the strands that are going to be more than likely most prominent this season or for the HPV vaccination. These are the strands that are probably, most people will probably come in contact. Therefore, when they make the vaccination up, The vaccination fights or creates its immunity against those or protects against those strains.
Particular strains, yeah.
Exactly. So, but what if a patient comes in contact with a strand that's not inside of that flu shot or that HPV vaccine? Then they, in fact, can get the flu or the HPV infection. But they study and they pretty much are, close to target in preventing and selecting which strains most people will come in contact with. But if someone says, I have got the flu shot this year, so I'm protected against all the flu strains. I will not get the flu. Was that a true statement or a false statement?
No, that's false.
Okay. Well, let's talk about the human papillomavirus. If a person says the same thing, hey, I got my vaccine, my HPV vaccine, so I'm protected against all the HPV strands or infections. What would we say? Is that a true statement or a false statement?
HPV human papilloma. That's the human papilloma vaccine.
Yes.
Well, the vaccination is not 100%. Like, I mean, you can still get these diseases or these infections, even though you get the vaccination, I think.
Exactly. It's just like the flu shot
Yeah.
because it only has those strands in there that they detected or determined that's most prevalent. So if a person says, I got my HPV vaccine, so I am protected against all the HPV infections. Is that a true statement or a false statement?
False.
So do we need to reteach?
We do.
Exactly. So test taking tip. If a question asks you, look at the statements below and decide if the patient needs which statement indicates that the client needs to be retaught or re-educated. You would look for a statement that the person is saying that is incorrect about whatever the concept is. So again, going back to when I initially started, answer what the question is asking you to answer about the concept. You have to think in the positive sometimes, but you have to think, well, what is this HPV vaccine? What does it do? Okay, well, this vaccine is created, it's supposed to protect the people in the event they come in contact with that disease or that strain. Well, we know this vaccine does not protect against all the strains. So if someone says or states that I'm protected against all, then we need to reteach. That was just a test taking strategy there.
Okay, and those are live vaccines, correct?
The HPV is
No,
live vaccine. No.
just the flu.
Just the flu. Yes.
Okay.
And now I'm hearing now it could be nasal. They're all different routes now. It's not IM is just not and that's not in our class in our reading required readings. But so let me come on back to task. So I was gonna say that now they have these different routes for these vaccinations, but we'll get to all of that. In the event that we should talk about infection control. Think about the chain of infection, how things get inside of us. And if it has open skin or some opening on the body, then there's that portal of entry. So be thinking about and that puts someone at higher risk for contracting or ending up with some type of infection because of that open lesion or some type of inflamed tissue. If there's some type of opening there, that person is at an increased risk of getting an infection. Okay, so the HIV infection, the antibodies, the way that it works, it takes some time before they actually show up in someone's bloodstream. So here's a scenario. We have a patient that comes in and they're requesting that they get an HIV test. They think they have encounter or come in contact with the HIV virus today. They test today. Those results are negative. What education should you provide that patient about further testing? Is further testing needed or is it not? So now let's go back and think. What is it about these antibodies? What'd you say now? Go ahead.
They need to be retested within 6 months for up to a year, I think.
So tell me why do they need to be retested?
Because the virus lays dormant for a period of time, and it takes time to actually grow and become, I guess, I don't know the right word to say, but relevant in the bloodstream.
Okay. So the
Three.
HIV antibodies, you're right, can take up to 3 months or 12 weeks before it actually shows up. So that person, not only they're testing today, that person will need to continue to be retested um, up to the 3 months or the 12 weeks minimum, because they can have a negative now, but within those 12 weeks of that 3 months, they can really be positive, because the way those antibodies react, they don't show up right away. It takes up to 3 months or 12 weeks. So we want that person, just the education that we're going to reinforce. Hey, yeah, you're here today, but you need to also come back and retest. And you will provide that information about how those antibodies work. Okay.
Okay.
Okay. Any for all of our STDs, we do want to prevent reinfection. So, and even if well, I know we're talking about STDs right now, but if a person's taking antibiotics for, any infection, we want them to complete the regimen. Even they should start to feel better, and usually that's when people stop taking the medicines. But we want them to, complete the regimen that's ordered to prevent that reinfection, because that's what we end up seeing, bacteria being resistant to medications, especially if a person has taken medications and they have not finished it, and that they're not completely cured from whatever they're taking the antibiotics for, then they get reinfected. And then the next time those medicines don't work as good. So we do want to encourage our patients to finish their medications. Okay, let's see. Our next topic was bioterrorism. Tell me some things that we can do in the event that water is not, we don't have running water. Something has happened with the water supply. There's no actively running water. What are some things that we can do? There's been some type of disruption. It could have been due to a storm, some acts of terrorism, what have you. But what can we do to make that water safe for us to drink? What can we do to that water? No, we don't like to think of it,
We
but
need to
we really
boil it,
can. Well,
but
we
I
can.
think not boil it for 3 hours, but over a 3 hour period, it needs to be boiled and then cooled off, and then we can consume it.
Okay, we can boil that water for 3 to 5 minutes.
Oh, not hours. Okay, 3 to 5 minutes.
Mm-hmm.
Okay.
We can add bleach to that water and let it stand for. I think it's 1 cc of bleach, which is equals about 16 drops, and then we let that water stand for the 30 minutes. It does this little process, and then we can get the water from the hot water heater. We also can get it from the commode tanks. I know it doesn't sound appealing, but really that water in that hot water heater in that commode tank, it has not been used. And so it's just sitting there.
So,
So
question. So, okay, so I know we can boil it for 3 to 5 minutes or add 1 cc of bleach to. Are they going to ask us like how much water? Like, are we going to be adding this 1 cc of bleach to
a gallon.
a gallon?
Mhm.
All right. So, and then we are able to consume, like to drink that water. I didn't
Mhm.
read it.
Yes, that water is safe. It is safe. Because think about it. The water where you're at, think about it. It goes through
It
those
has
little water
chlorine.
plants and those things. It's all kind of additives and things in the water that makes them safe for us to drink. Anyways, that's a normal process that they do. But
Okay. Water from hot water heater.
because it's sitting there, it's just waiting to be used anyway.
And it
It's
has
just a container.
contaminated. If the contamination is just started, then that water that's already sitting there is purified or clean.
It is. It's out. Yes, exactly. Because remember, there's been a disruption, so that water is not flowing. So everything has ceased. There's like, think of it as like everything has just stalled. So, like you're saying, it has not being running through the process. It's not running through those pipes. It's just sitting there. So, in the event that someone has a chemical spill, and they come in, we're at the urgent care or we're at the emergency room. Of course, we have on our personal protective equipment, but in addition to that, we think it's a chemical spill. What else should we be using? I know we're gloved up to be handling those clothing. What else should we be using? Or is it okay for us to just, the nurses just to have on their gloves?
No, I think we need to have on gloves, gown, goggles. Um, I think we may need some thicker gloves, like I don't know what it's called, but um, I really don't know the answer to your question. I'm sorry.
Okay. So clothing and contact lenses are considered contaminated and they should be removed and thrown away. The nurse should use tongs to prevent touching directly those clothing. The contact lenses should be thrown away, as I just said, and then the eyes should be irrigated with water for at least 10 to a minimum of 10 to 15 minutes. And those clothing should be placed in a plastic bag for disposal. So again, we're not going to just throw those clothes in the regular trash. We're going to tie them up securely. We're not just going to grab those clothes with our hands. We're going to use tongs. And they have them in the in the healthcare facilities. They have them in their little kits. They're not just usually laying out. But that's another layer of protection between us and coming in contact with that chemical that might be on those clothes.
And we would ask them to remove the clothing, correct?
We will assist. And in either way, if they remove them or we remove them, but when we get ready to contact the clothing, we use those tongs. That
Okay.
the point is we have the gloves on, but we still need something else to put that distance between us.
Okay.
Okay. So usually all of those chemicals that might be used in bioterrorism, they attack the respiratory system. So we think about all things respiratory, counting respirations, listening to those lung sounds, oxygen, inhalers, mechanical ventilation, um, non-rebreather masks, turning cough, deep breathing, everything, all hands on respiratory, because usually that's what those agents like sarin, what's another one? But usually they attack that respiratory system very viciously. So be thinking about all those respiratory interventions that we can use to assess and keep that respiratory system functioning like it actually should. So where does home health take place at in a person's what? In their
Home.
home. Exactly. So we have our patients, they go to the hospital, but they're not going to the hospital to stay. They come back home. They may even go to a long-term care facility or a skilled nursing facility, but prior to going home. But there should be communication between that hospital and that home health agency or the hospital and that skilled nursing facility so that that patient can have that continuity of care. That helps having that communication. It helps the next person or the next agency or setting establishes that baseline. It helps them to identify resources that patient might need while they're in the home or even if they go to that skilled facility. Whether or not that's therapy, they may need therapy, they may need concentrator, cane walker, or crutch. But communication is essential in order to provide the best care for that patient and also to continue that continuity of care for that patient. We do want our clients to be as independent or safe as possible. If they're going to that skilled nursing facility, they still have that 24-hour care. But if they're going home, they're going to have intermittent care, meaning, we as the home health nurse may come in on Monday, Wednesdays, and Fridays. We may come in on Tuesday, Thursdays, but we're not there 24/7. So we do want our clients to be as self-care, to participate in self-care activities so that they can gain that independence and can hopefully stay in the home safely, get back to their optimal level. The home health system, I don't know if you ever heard people say there's a lot of documentation for home health. When Medicare was introduced, it opened up for the opportunity for people to receive that care in their homes. But as a result of that, they needed documentation to support why is the nurse here? Why is the unlicensed personnel in this patient home? So the Omaha system, the nurses got together, they call it the Omaha system, and it's just a documentation system that addresses everything from A to Z that is required for that home health documentation. And so the Omaha system is typically used. So even if there is an electronic database that the home health company is using, they are going to use that Omaha system as the basis for their documentation. Because like I said, it addresses all of those things that are relevant to home health. And so it's typically used by those home health agencies because it's standardized to address all of those things that the insurance requires that they have information on in order for that patient to continue to receive those services in their home. So for culture, we need to, of course, identify what our own cultural beliefs are. We start with us. We do want to establish those therapeutic relationships with our patients. We want to identify those trusted community leaders. That those trusted community leaders could be person of faith. It could be the PTO president. It could be commissioners. But we want to identify that trusted leader in that community because that helps us to gain access to the community members because and it may be more than one trusted community leader, but once the community members, so to speak, get the go ahead from the trusted community leader, then you can go in and implement your interventions. They'll be receptive to tell you about the good, the bad, and the ugly. Trusted leaders provide that entry point into the community. And they can also help us develop plans if we're trying to come up with a plan and identify the needs, the actual needs of that community. Those trusted community leaders will assist you with that as well. And also, they'll rally the troops. And so, if somebody comes in, they're more likely to be receptive to the things that we're trying to do in the community. When we're trying to get information out to our patients, no matter what the setting is, no matter what their first language is, we want to make that information or have that information available in that person's first language. Whether or not if we're doing it, if we're putting in writing a newspaper article, we're doing a radio announcement, TV, if we have flyers, we want to make sure it's in their that first language. Because think about it. If your first language is German and everything is in Spanish and you don't know Spanish, then that doesn't do you any good. That's just information that's out there. So we want to make sure that we have that information no matter the format, flyers, whether or not it's radio, that is in that person's target or either their first language. Okay, I'm going to pause here. Are there any other concepts that that you have questions about?
I wanted to ask a question. You said that the exam 3 is going to be on week 7, 8, and 9.
Yes, it's the remainder. That is everything. So we're in week 9 right here. Today starts week 9. So it's the information that you would gather today this week in class, plus the previous 2 weeks.
Okay. Because she initially just told us week 7 and 8. So okay, she may not know.
So it is. We're wrapping it up because this is week 9. Exam 3s are in week 10. HESIs are week 11. So we meet back after week 9. The only other time that we'll meet for material to review material is for the HESI review. Okay. And then remember, you all had the HESI prep assignment. That assignment is what it is. It's an assignment as well, but it's a HESI prep. All of those topics you're game for or may see in some format on the HESI. Remember, use ADPI. And when you're looking at any concept, just consider ADPI. Even if each one of those does not apply, using ADPI helps you to think through things structured so that you don't forget anything. For example, like we were talking about the the different if bioterrorism, they were using some type of agent. Well, most of those agents attacks the respiratory system. So what things will we assess? What should we be planning for? If it attacks the respiratory system, then we need to be assessing our lungs and respirations. And then what should we be planning for? Breathing treatment, supplemental oxygen, mechanical ventilation. So that helps you to think structure. And so therefore you don't forget anything. Now, all of those might not apply to the concept that you're talking about.
Mm-hmm.
Like I said, it keeps you to think it forward and backwards, and so that you can identify there's no gaps there. So week 9, last class, week 10, for sure by the beginning of week 10, and some of you all may have already start receiving HESI information. Remember, it is specific to your campus. And remember, if you have night classes, your HESIs generally are not given, especially the late night classes. Usually HESIs are not given at 9 and 10 and 11 o'clock at night. So remember, week 11 is going to look a little bit different from your traditional term as it has been if you're taking those late night classes. But reach out to your campus team because HESIs are specific to campus. So one student is saying, hey, we're doing this on our campus for this class. Like, wait a minute, but I'm on a different campus. I need to see what's happening on my campus for this class because it's probably going to look different. Please commit to at least going back, looking at the exam review. We will provide the links as they're available. Go back through your classroom recordings and commit to looking at those as well.
Yes, ma'am. I appreciate it.
You're welcome.
Thank you. You have a good night.
You too.